people?
So measles is a viral condition that can be spread through a respiratory tract. It can also be spread on person-to-person contact. What makes measles pretty unique is that it can stay in the air for longer than the normal virus, and you don't necessarily have to be in the spray of it, but you can be. But it will last longer once you're in the spray.
So that's why it makes it so highly contagious, because it can
Exactly.
stick around longer than your typical virus.
Right.
Obviously, when you have measles, there's the rash. Everyone sort of has seen that. What are the symptoms of measles?
So it can mimic common things that we see, like rash, runny nose, fever, chills, congestion, sore throat, maybe some laryngitis, many other viral conditions. So it's hard to really tell sometimes. In children, it's a little bit easier because they do have some pathognomonic findings on their physical exam, but in adults you may not be able to tell.
Okay, which also makes it tough, right? You may not know right away that that's someone, whether someone has.
Exactly.
So when people say this is the first case in Chicago since 2019, like, why is this a big deal that we actually have a measles case in Chicago?
Well, many of our specialists, I mean, when the accomplishment of vaccinations in younger patients has created a situation where they are so well vaccinated, our kids, that conditions that they saw back in the 50s, we're not seeing anymore. All those kids in the 50s did not bring those diseases into the 60s, into the 70s, into the 80s. And as a result, when we have folks who come in into the environment who are not vaccinated, and they do come down with these conditions, our bodies are to a degree immune to them, but we haven't seen it. So our immunities haven't really been tested as much as they should be, such as the flu. Okay. Flu comes out all the time, so our immunities are always tested.
Okay. So for people, the question again asked by one of our producers today was, I was vaccinated as a kid, now I'm in my 40s. Mm-hmm. Do I still have immunity? Am I protected from this outbreak? What would your answer be?
So generally speaking, if you were vaccinated as a child, you should have immunity. Now, with that being said, if you are immunocompromised, because what you are when you were 7 is not what you are when you're 57 or 67 or 47 for that matter. If you have an immunocompromised condition, and this includes stuff such as cancers, being on treatments, diabetes, obesity, hypertension, you should really talk to your primary care provider about, is it worth getting another MMR vaccination?
Okay, so it's an individual, especially if you're in a high-risk setting, then you may, if you work in a hospital, if you work in one of these shelters, that would seem to warrant the conversation.
Or even if you work in an aggregate setting, such as a nursing home or a boarding situation where you're dealing with a lot of people living in a situation.
Okay. Now, the other question I think for people was, it isn't 100% effective. No vaccine is 100% effective, right? It's 97%. So again, if I am not high risk, what is my risk of getting measles, again, now that we know that we have cases in Chicago?
So your risk of getting measles is if you're in the proper place to get measles, so you have to have the virus somewhere around you. Mm-hmm. That does not mean if a measles outbreak is happening a mile away from you, that you are in a situation where that's happening. Mm-hmm. If you are in a situation where it just makes common sense for viral conditions we're having now. If you're in a situation where there's someone coughing or sneezing and you don't feel comfortable, wear your mask, make sure you wash your hands, all the precautions we take for regular viruses.
Okay, so that's really the best way to protect yourself, again, besides getting vaccinated.
Correct.
Now,
absolutely.
The concern for unvaccinated, obviously we have all these new arrivals coming in, many traveling, bringing very little with them. Mm-hmm. If someone does not have proof of vaccination, what would your recommendation be? Should they be vaccinated anyway? Is there any harm in vaccinating them again, even if they say they were vaccinated?
So those who do not know their vaccination status, or those who feel like they may need a booster, the measles, mumps, and rubella vaccination, or the MMR, is a very, very safe vaccination. We've given it to hundreds of millions of doses, and it's one of our most safest vaccinations that we have. So I don't hesitate to tell them, let's just go ahead and get an MMR and catch up, or give yourself some documentation that you had it done.
Okay, and anyone who hasn't been vaccinated, my understanding is children would need 2 doses, adults would only need 1, is that correct?
Children, the assumption is that adults have had their boosters before, that's why they only need 1. Okay. But it's not necessarily the case. So there are catch-up regimens that we follow for people who don't know their vaccination status. Children should follow or do their catch-up because every age has their vaccination set of vaccinations they should have. But if they don't know, they can catch up with the vaccinations.
Okay, and another question is that people were asking too is we do know that there have been these exemptions. There has been a rise in vaccine exemptions for schools and things like that. Illinois is still one of the higher, immunity states with immunity, but Florida, for instance, I know California had to reinstate their mandate because they saw some outbreaks. Is the campaign for the anti-vaccination campaign, is that hurting herd immunity? Is that something that parents should be aware of?
I'd like to take this attitude. If you are not getting vaccinated, you put yourself at risk for getting the disease and getting the complications for the disease. It's kind of like what we had with our COVID vaccinations. It doesn't stop you from getting COVID, but it will stop you from getting into the hospital. If you don't vaccinate for measles, then you are set up for getting all the possible complications of measles, as opposed to someone who's maybe had one or two.
Okay. So is that something that, do you think healthcare professionals need to be paying attention to? The fact that we have seen this rise in exemptions.
Yes.
Could we be seeing more measles, even though Illinois still remains one of the top states? Could we be seeing more measles in the future?
We could be seeing a lot more of those childhood conditions that have been kind of improved by vaccinations, because we have free pass of people from all different states, and so we can possibly see a rise in that. But within Illinois, we kind of are very good at pinpointing where we see our outbreaks, and we usually can tell relatively easily, because of our high vaccination rates, what kind of populations we'll be really targeting our treatments for.
Okay, so I guess the last question would just be simply, people are going to see this, measles cases in Chicago. Who should be concerned?
So the folks who should be concerned about the measles outbreak are those who have never been vaccinated, those folks who are living in situations where they're in a cluster or are close communication with other folks, those who are behind or don't know their vaccination status. They should be concerned, but then they should also speak with a primary a healthcare provider about what are their true risks and what are the next steps to keep them safe.
Okay.